The primary causes of head and neck cancers are mostly commonly the tobacco. Either it can be a smokeless tobacco or with smoke. Like smokeless tobacco, you know, is a pan, hookah, all these chewing materials. Smoking like cigarettes, BDs, cigars or pipes, whatever. And erica nut is also important causative factor for the oral head and neck cancer. And next is the alcohol. Alcohol with smoking prevalence increases the cause of head and neck cancers. And next is ultraviolet radiation exposure and radiation therapy exposures and occupational hazards and HPV virus. Coming to HPV virus, human papilloma virus. Human papilloma virus is mostly a sexually transmitted virus which causes oropharyngeal cancers. And we come across with the Epstein-Barr virus, which causes mononucleosis. Through this also, the head and neck cancers can be arised. As I told you, head and neck cancers can comprise of various sites based on that oral cavity, hypopharynx, nasopharynx, or larynx, or salivary gland tumors, all these things. So, if you can consider the oral cavity or hypopharynx endoscopy, there are any red and white lesions or any unusual bleeding, any non-healing ulcer, any loose tooth of no proper etiology, and pain, trismus, means not able to open the mouth. All these things can be considered. If it is larynx, an example, larynx literally might cause hoarseness of voice, and dyspnea means difficulty in breathing. Can also be this one of the signs and symptoms of head and neck cancers. If it is a salivary gland tumors or salivary gland neoplasms, sometimes the facial nerve palsy, trismus, severe ear problems, ear pain, can be considered. First is any case has to be physically examined, and based on the old history and proper history, we need to go a series of tests. It can be either blood investigation or a radiological investigations or invasive procedures such as biopsy has to be done. So these are the series of tests. Based on the site and area, we will consider the different investigations. So coming to the blood investigation, sometimes we have tumor markers which can be elevated. You have to consider. If it is radiologically, we have starting from X-ray, ultrasound, CT scan, MRI, and PET scan. PET scan is for finding out any distant metastasis or not. And coming to invasive procedures such as FNAC or biopsy has to be considered. Through all these procedures, we can come to a conclusion and diagnosis the head and neck cancers. Treatment options for head and neck cancers are only 3 modalities are available. How internationally, one is surgery, radiation therapy, and chemotherapy. Surgery is removing the tumor or cancer along with the normal tissue, adequate normal tissue. This is the surgery. So based on the site, we decide whether, and based on the stage, we decide whether it can be operable or not operable. Next is radiotherapy. Radiotherapy is using X-rays or proton rays, killing the cancers. Normally used therapy uses external beam radiation therapy, where we can use X-rays and kill the cancer cells along the site. Next is chemotherapy. Chemotherapy is injecting the drug through the blood, into the blood, which is called a systemic therapy, which acts on the cancer cells to prevent proliferation or growth, or and helps in reducing the disease. So in chemotherapy, we also have advanced therapies like targeted therapy and immunotherapy. Targeted therapy is which targets the exact DNA or the protein of the cancer cells. It's a immunotherapy. It acts enhances the immune system, self-defense, which to prevent the cancers. These are all the modalities available for the treatment of head and neck cancers. If treatment is not taken, if it is stage 1, its curative chances are more. If it's stage 4, the survival rate of the patient is going to fall drastically of less than 30%. If it is not cured, which goes beyond unresectable or not treatable cases, so that will be the fatal to the patient. So in head and neck especially, this patient will not able to, if disease progresses, all this dysphagia, dyspnea, all this facial disfigurement, bleeding, ulcerations, everything will be happening. So better prevention is better than cure. So early diagnosis helps in treating cancer in better way. Every treatment has its own side effects. So surgery. So we are removing a part from the body. It means a tumor which has overgrown or a normal cell which has overgrown. We call it as cancer. So we are removing along with the normal tissue. So whatever the part we remove, so the area has to be reconstructed. So there will be a disfigurement and there will be some numbness, pain issues, swelling, and other issues like dysphagia, difficulty in swallowing, or sometimes difficulty in breathing. All these things has to be for surgical complications. And coming to radiation complications, during radiation, we find having leukocytes, small ulcers over the oral cavity or pharynx or down the tract. And we can have discoloration of the skin. So there will be changes in the skin which discolors to the dark, where the salivary glands are included in the radiation film. So there will be less saliva. So that is also one of the major complications, which causes dysphagia, difficulty in swallowing. For chemotherapy, we have complications like nausea, vomiting, diarrhea, and there will be immune suppression. So there will be a risk of catching infections in patients who are undergoing chemotherapy. Preventive measures for head and neck cancers are like the major causes are alcohol and tobacco. So this has to be quitted. Both habits has to be cessed. So preventing these two can help in reduction of major number of head and neck cancers. And next is human papillomavirus, which is sexually transmitted or which causes oropharyngeal cancers. So this has a vaccines, HPV vaccines. So vaccines can be administered at a particular age, which has to be prescribed and administered. And in occupational hazards, you can always avoid that occupational hazard. So means the place we work or taking precautions while working in and around it. And exposure to ultraviolet radiations also, we can prevent from applying sunscreens or prevent precautions wearing hat or something.